Wes Streeting, who's the Shadow Health and Social Care Secretary. Mr. Streeting, good morning to you.
Good morning.
Well, we now hear that the public is at its unhappiest level it has ever been at with the NHS. This is a survey, British Social Attitudes. How have we come to this and what would you do about it?
I think bluntly, the NHS has suffered from terrible mismanagement over the course of the last 13 years by the Conservatives that's left the system desperately short of the staff it needs to get patients seen on time. That's led to the highest waiting lists in the history of the NHS and the lowest patient satisfaction ever. And what I hear commonly from patients, and I experienced this a bit myself with my experience with kidney cancer a couple of years ago, people could not be more praising of NHS staff. They think they're doing a brilliant job, but there simply aren't enough of them. And that's why Labour's got a plan to deliver the biggest expansion of NHS staff in history, funded by abolishing the non-dom tax status, because we think people who make Britain their home should pay their taxes here. And that would enable us to give the NHS the staff it needs to get patients seen on time, alongside a wider range of reforms to make sure that the money going into the NHS is being spent to best possible effect and impact for patient care.
Yeah, look, I'm not here to defend non-dom people at all, but it always sort of jars with me when Labour bring this up, because I just want to be clear. People who are working in this country as non-doms do pay their taxes on what they earn here in the UK. They're just given some relief on what they have from their overseas benefits, which is, you know, is important to point out because it implies there's some sort of exploitation of the tax system. But they are paying taxes on what they're earning here. And of course, when France changed the rules in the way you're describing, François Hollande did this. We saw a huge exodus from Paris to London to the benefits of the financial capital here, which of course has benefits for our taxes and therefore the NHS.
Well, we relied on research done independently by the London School of Economics and Warwick University to make sure that our policy would deliver the revenues that we need to fund the biggest expansion of NHS staff in history, and also to fund free primary school breakfast clubs in every school in the country. I do think politics is about choices ultimately. We've got the highest tax burden in 70 years because of the Conservatives' mismanagement, but look at where that burden is falling. It's disproportionately on people on low and middle incomes who are really struggling at the moment. Even people who'd normally consider themselves to be on decent incomes are looking at the end of the month, looking at the bills and looking at how much money they've got in their bank account, and they are worrying. And why is it that they always hike up taxes on people on low and middle incomes, but whenever it comes to people who've got higher incomes, they come up with this whole list of excuses as to why it wouldn't be possible or desirable or practical to ask those people with broader shoulders to pay a bit more to help our country through this crisis. And we make no apology for saying that we think the tax burden on working people is too high, and that in order to fund our policies, we want to focus on getting the economy growing so we don't have to hike up taxes. And in the meantime, where we do need extra investment in our public services for things like NHS staff expansion, we'll show where we'll get the money from, and we'll make sure that's not falling on people on low and middle incomes, because I think they are already being bled dry by this government.
Although no acknowledgement there that in the last 13 years, nothing to do with the fact it's a Conservative government. There have been all these factors. Brexit, which would have happened under a Labour government as well. We've also had, as you know, the pandemic and the war in Ukraine, all of which have had huge impact on us here in the UK. The government at the moment trying to steady the ship, and it's been proven that margin in the polls is being narrowed with Labour because the public are beginning to see that. And just today, it's being announced in front of the FT, the Chancellor, Jeremy Hunt, to provide fresh cash for the NHS, £3 billion injection, and this follows on very quickly after a £4 billion settlement deal with NHS staff over 2 years.
I think I'll say a couple of things. One is, of course, COVID made things more difficult. So has the war in Ukraine. Those are factors outside our government's control, and we cut them some slack on those issues. In fact, tried to help them and support them on those issues. But that doesn't explain why we went into the pandemic with NHS waiting lists already at a record 4.5 million, 100,000 staff shortages in the NHS and 112,000 vacancies in social care, which left our health and care system dangerously and avoidably exposed to the pandemic in a way that otherwise it wouldn't have been. And so I don't think the Conservatives can say this is all out of our control and, you know, haven't we been unlucky? It's been 13 years of bad political choices. We don't take voters for granted at the next general election. That's why we're always setting out Labour's alternative, including how we would pay for our policies so people can have confidence. But I'd just say, after 13 years, asking the Conservatives to solve big challenges in our country, whether that's the NHS, whether it's immigration, whether it's the state of our economy, is like asking the arsonists to put out the fire they started. It's just not going to happen. I think it is time for a change in our country. Only Labour can offer the fresh start I think Britain needs at this stage. And look, if people don't like what a first term of a Labour government does, they don't have to elect us for a second. But I do think it's time for the country to give change a chance, and that's the argument we'll be making in the run-up to the next general election.
Just a word from you on Jeremy Corbyn. Do you think Keir Starmer and the NEC have made the right decision? Some suggestions that it should have been left up to the local party in his constituency, who I understand very upset about it, and indeed to his constituents to decide whether or not he should be standing.
I'm afraid Jeremy Corbyn has no one to blame but himself for this outcome. His response to the Equality and Human Rights Commission's damning indictment of the Labour Party on anti-Semitism under his leadership was frankly appalling. He was given ample time and space to apologise. He didn't. And when Keir Starmer said he was going to tackle anti-Semitism within the Labour Party, he meant it. When he said he was going to change the Labour Party to make it credible and electable and able to deliver real change for our country, he meant it. Keir Starmer has shown the strong, decisive leadership that the Labour Party needed after our worst defeat since 1935, and he is ready to show the decisive leadership our country needs too. And I think the decision that was taken yesterday makes it more likely for Labour to win the next general election, more likely to turn a page on that worst defeat since 1935, and frankly shows the voters who gave us a massive kick-in at the last election and told us to raise our game, gives them the respect that they deserve. We've listened to the voters, we've changed the party, we're ready to change the country too for the better.